All right, so now we're moving on to the next segment. After we've heard from Prof. Razif, our former lecturer, it's now time to hear from our former student. Most of us know what it's like to be a doctor, but not all of us know what it's like to experience life as a patient. We have with us today Dr. Zaim, an orthopedic surgeon who is a UM alumnus, having graduated with his master's in orthopedics from University Malaya in 2016. He'll be sharing with us the experience he's had of straddling both worlds as a doctor and now as a patient, a cancer survivor of stage 4 lymphoma. And now I'm very proud to pass the time over to Dr. Zaim. Over to you.
Yeah, we are like dwarfs on the shoulder of giants so that we can see more than they and things at a greater distance, not by virtue of any sharpness of sight on our part or any physical distinction, but because we are carried high and raised up by their giant size. I don't get the opportunity enough to thank my teachers, lecturers, and professor, especially those that have just retired or retiring, like Prof. Sarah and Prof. Razif, because whatever progress that we make in our career today, it is because of the foundation that was given by them many years ago when we first started our journey in orthopedics. So we are just like dwarfs on their giant shoulder. Assalamualaikum and good morning. My name is Zaim. I will be sharing with you my experience in battling stage 4 lymphoma. The title of my talk is A Beginner's Guide to Surviving Cancer, because it has only been 2 years since my diagnosis. If I'm lucky enough to give the same talk 20 years from now, then I suppose you can call me an expert by then. So this photo was taken in 2016. It was the year that I finished my master's program. And from the picture that you can see, me and my colleagues, we are all very happy. For me, life couldn't have been better. I got my career right on track, and I'm sure the same goes to all those that have graduated this year. And I have a beautiful family, and we were planning to move into a new house. So it really felt like a brand new fast Ferrari moving through life, you know. However, little did I know that barely 1 year down the line, that 3 words would put a sudden stop on this speeding Ferrari. It all started with just an incidental finding. I had a bad week of fever and cough and runny nose, and usually I don't do this, but for some reason, I decided to do a chest X-ray at the hospital I was working in after the ortho clinic, and I got a shock with what I saw. I was feeling just fine before this, had no symptoms at all. So just to check out why I was having such a bad bout of URTI. So after the chest X-ray, I managed to get a CT thorax on the same day. And everyone, the radiographer, the radiologist, and the medical physicians and the hospital on that were convinced that it looked like an infection. But, you know, just to be safe, I proceeded with the bronchoscopy and biopsy. Showed nothing, and the pleural tap showed nothing as well. I was treated for tuberculosis, for TB, although my cultures and all were negative. So I was on anti-TB for 4 months, but the pleural effusion did not resolve. I started getting complications from the anti-TB, and the worst of which was gout, because it was so bad that I had to be on crutches for about 3 weeks. And eventually I was planned for thoracotomy and pleurectomy. So basically, because my pleura was so thick on the CT scan and all that, that they thought that they had to scrape my pleura to make the anti-TB medication more effective. So this was a picture of me in ICU the day after my surgery. It was my first time going through surgery. So you basically fall asleep and wake up in a lot of pain. And the worst pain would have been from this to a good friend of mine, the chest tube. It was quite bad actually, having chest tube. I mean, I never thought it would be that bad. Coughing and taking deep breath and all that was really painful, and I had them for more than a week. So because of this, after having like tubes and especially this chest drain sticking out of my body, I have greatly reduced the number of drains that I use for my patients. And funny enough that after the surgery, the surgeons came to me and said that the whole procedure went well, and they were 99% sure that that it was TB. Well, and then the biopsy results came out. I think the doctors and surgeon that were treating me were probably more shocked than I was. I had a mild lymphoma of the pleura. It is a type of a non-Hodgkin's lymphoma. And apparently the incidence of this cancer happening in the lung and pleura is quite rare. And this was the PET scan that I did right after the surgery. It showed that the tumor has spread all over on the left part of my lung, the pleura, even went to the pericardium and adrenals. So basically, I had stage 4 of non-Hodgkin's lymphoma. So when God sends you some of the best cheerleaders that anyone can ask for to be by your side, your first instinct would be to give your best and fight this and not to let them down. I chose to be optimistic. In a way, I was relieved that after months, I finally got a diagnosis of what was wrong. And all I wanted to do was to get treated and carry on and continue with my life. I researched on the prognosis, and I came across people who've had a similar diagnosis and found inspiration in the fact that they are doing well, even up to this day. One of them being the Prime Minister of Singapore, and the other being our own Prof. So it gave me like a positive a goal or vision to set where I imagine myself to be once all this thing is over. When I first became unwell, I decided to play the role of a good patient. Just follow whatever the doctors say, However, after being misdiagnosed and the fact that the true diagnosis was quite a rare condition, I realized that the typical patient is actually not the good patient. The typical patient is actually the naughty one that goes around to shop here and there. Well, I didn't actually go to shop around, more than the fact that this is quite rare, and just to find out what is everyone's experience in treating it. Some of the oncologists and hematologists that I saw have never even treated mild lymphoma in the lungs. But almost all of them agree with the chemo regime that was planned for me. And so, yeah, that was good. But before starting chemo, I decided to have some fun. At this point in my life, I can get away with anything without my wife nagging at me. So I went on a shopping spree. And on the plus side, I haven't lost so much weight ever since I got married years back. I could fit onto a lot of, clothes that otherwise would have not fit me. So the other thing, this chemo regime that I was supposed to go for is notorious for causing hair loss. So I decided to do something different to my hair. And again, at this point, I can do anything and just get away with it, you know. And so I became blonde. This picture was taken on the first day of chemo at the chemo suite. I was quite surprised that, you know, my hair did not fall off immediately. I managed to enjoy being blonde for about 3 weeks. That it came to a point that I was quite confident and cocky that I was not going to lose my hair throughout the 6 to 8 chemo cycle that was planned to go through. But unfortunately, 2 days before my second cycle, it all dropped in one night. But that's okay, because I've got other tricks up my sleeve. So I shaved my head and put a henna tattoo on my scalp. And this was inspired by Ragnar Lothbrok from Vikings. It was a Netflix series I was watching all through this time. So this picture was taken during my second chemo cycle. So in order for the treatment to be successful, I had to change my perspective of things, you know. You know, as a doctor, medical students, you know, you learn about the side effect chemotherapy and how horrible it was and all that. But at the very essence of it, chemotherapy is a very effective weapon in battling the disease, especially the particular cancer that I have. So rather than fearing it, I might as well embrace chemotherapy as a friend and do whatever it takes to make it as effective as possible to kill the cancer cells. As a doctor, I never imagined using any alternative medicine for myself. I've always relied on evidence-based medicine, but once you become a patient and you know, your life is on jeopardy, your perspective on things change. I did anything I could to fight the cancer, anything I could to supplement the chemotherapy. So I came up with a 5-step regime to make chemotherapy more effective. Now, this one, hyperthermia, thermal therapy, was actually inspired by Prof. Sarah. Although I didn't travel very far, I just did it at home. So after chemotherapy, I would usually go into a hot bath. I would make sure that, just like how Prof. Sarah mentioned, that the bathtub, I would heat the water up to about 40 degrees. I even carried a thermometer around with me so that I had to make sure that I don't boil myself into a prawn. And then, and always I needed somebody to stay there and supervise me, because I didn't want to pass out right after chemotherapy, like drown in like some hot water, you know. So in the picture, you can see that me sitting in a hot bed. This hot bed is courtesy of my mother-in-law. She's a Kelantanese, and she's a strong believer in all sorts of alternative medicine. I think she spent easily about 15 to 20K in getting this hot infrared bed with the hopes that it will cure all her illnesses. Well, it didn't cure any of her illnesses, but I found a good use of the bed to induce this hyperthermia in my body. So I would spend, you know, at least an hour a day in this hot bed watching Netflix in the few days after the chemotherapy. And that small picture there is like me receiving chemo with a hot blanket over my chest and all that to make sure that the chemotherapy gets to all the right areas. And the other thing that I would regularly do is exercise. And so after every chemotherapy session, I would go to the gym and spend an hour cycling, just to get all the medicine to circulate all over my body and stuff and all that. And I think there's no better way to tell your body, you know, to continue and to tell your body to continue and to fight on than, you know, doing exercise and working out. So for those who are unfortunate enough, they would see me quite often shirtless around Lake Gardens in Kiara Park around this time around. soaking up all the vitamin D and exercising. Apparently, most of us are vitamin D deficient, and that is actually true for me because I did a blood test to get it checked. And apparently, having an optimal amount of vitamin D is good for fighting cancer cells. I'm not sure how hard or strong the evidence is, but it doesn't do you any wrong not to optimize your vitamin levels. But just make sure that you don't go overdose, because then can cause you to get stones and all that. But of course, exercise is always better in the company of your friends and family. This was a hiking trip that I joined with my friends in the ortho department. One thing that was memorable about this trip was that despite Prof. Sarah being twice my age, but I think she got up to the top of the hill before I did. And theoretically, from what we've learned, that to live healthy is to eat healthy. Everybody tells me to stay away from sugar and focus more on a plant-based diet and stay away from all the steaks and red meat that I usually enjoy. But honestly, I failed quite miserably in this department. Eating healthy was probably the hardest thing to be disciplined about. I was swallowing about 24 tablets of prednisolone a day, and I blame that on boosting my appetite. So while I obviously don't encourage anyone who has to go through what I did to eat the way I do, but at the same time, you have to keep yourself happy. And if you've known me from before, good food and me are never far apart. And so this has not changed up to this day. And I managed to gain back all the weight that I lost and even more. So last but not least is definitely rest. It is something that is often overlooked, but your body needs to recover. So I always make sure that I get a good night sleep, and got my wife to do most of the responsibility with the kids so that I don't get stressed out. So I suppose my mother-in-law's expensive hot bed actually worked, because just after 3 cycles, my pleural effusion was completely gone, and so was most of the tumor. So I was very lucky that my body responded to the chemotherapy, because some people don't. But however, there was just that one small part, if you can see there, that was a bit stubborn, and that made me had to go through radiotherapy before it eventually all went away. So this was the last PET scan I did, which was exactly a year ago in December, and it showed that I no longer had any trace of cancer in my body, and I went back to work the month after. So where do we go from here? Well, I have another PET scan this Monday. So I hope that you can all pray for me that it will be another all clear. But I try to keep to these principles in the hope of remaining healthy and keeping all the cancer cells at bay. What have I learned? Well, weird things happen to doctors. But thank God that managed to get it sorted out at this moment. And the other thing is to be nicer to patients, because it is not really a nice experience having to lie down in a hospital bed for days. I was lucky that I managed to stay in a single room, but most of the patients that we treat, they are in a crowded ward, with no aircon. And so it is important that we be more emphatic towards them, and be nice and just understand what they're going through, because I certainly had a good insight in what it is like to be a patient. And the other thing is to live life in the moment. Before I used to have great long-term plans and stuff and all that, but sometimes you may overlook the things that you already have. But now, I start to enjoy and appreciate more with whatever that I have now, and make more short-term goals rather than long-term ones, And more importantly, is unwavering faith in God. So I would like to thank, these are my three important cheerleaders, the three important girls in my life. And of course, I would like to thank, got massive support from my parents, my siblings, my in-laws, friends, and colleagues. So I would like to take this opportunity to thank all of them. Before I say goodbye, I would like to share a poem by Dylan Thomas. Do not go gentle into that good night. Old age should burn and rave at close of day. Rage, rage against the dying of the light. The wise men at their end know dark is right. Because their words had forked no lightning, they do not go gentle into that good night. Rage, rage against the dying of the light. Thank you.
Thank you so much, Dr. Zaim. This year's NOCERAL Day's theme is Fight Song, and we could not have found anyone more apt to share with us his fighting spirit in fighting cancer. We're incredibly honored to have you, and I'm sure everyone agrees, judging from the uplifting comments that we see in the chat box coming from Dr. Krishna, from Fai, from Dr. Amber, and numerous others. It's also great to see Dr. Rusdi and Dr. Teo, as well as Prof. Tuku Sara, joining you on your journey in fighting cancer, in this case, quite literally on a journey. We're so happy to hear that your latest PET scan came out clear, and I'm sure the department and everyone else who's listening in is definitely keeping you in prayer for your upcoming PET scan this Monday. All right. I'm sure that all of you are also reading the chat box would have seen Prof. Saw's comment that he should have tried dyeing his hair blonde. Anyone agree with me? Go ahead and type blonde in the comments. Let's see how many blondes we can get to get Prof. Saw to dye his hair yellow.